I was shocked to recently learn that the UK has one of the highest rates of asthma in the world. Why? To be honest, we don't know exactly why, but we do know that it forms a massive disease burden. Personally, I see at least one patient a day with an asthma-related issue, and if it's in the winter time, it can go into double figures. In the UK, around 8 million people have asthma. That's about 12% of the population. It's by far the commonest chronic lung condition by a country mile. But the worrying thing, apart from not knowing exactly why it happens, is that many people don't even know why they have it. Asthma isn't actually a straightforward condition. Loads of things can affect it. It happens in certain subgroups of people, in both kids and adults, and it can rapidly worsen and become deadly. In fact, over 12,000 people per year die from asthma, which is 1,200 people too many for a manageable condition. One of the common questions we get in clinic is, do I or does my child have asthma? And it's not a straightforward question to answer for some of the reasons I just mentioned. Let's unpick it a little more, but first let's cover some of the basics. What is asthma? We know it's common. It affects both adults and kids, and you probably know someone that has it. It's a condition that causes difficulties in breathing due to having swollen and inflamed and generally sensitive airways that become narrow and clogged with sticky mucus. It's a chronic condition, so it's kind of always there, and currently there is no absolute cure. For some people, their asthma is mild and it rarely bothers them, and they may only need occasional treatment. And for others, it's a daily and major issue, and they need all sorts of different medications to manage it. For most people with asthma, they experience times when their baseline breathing symptoms can get much worse. The commonest symptoms that people notice with asthma are wheezing, which is a whistling sound that occurs when you're breathing, and it's something we can hear very easily with a stethoscope, even if you can't hear it. Breathlessness is another common symptom, as well as a tight chest sensation. These are all really horrible symptoms to have, and not being able to breathe easily often makes the breathing even worse and even more chaotic, exacerbating the symptoms even more. Coughing is another common and classic symptom, and it tends to be worse at night and in the early hours of the morning. We don't know why people have asthma. We know that things like genetics, pollution, modern hygiene standards, and dietary factors are all probably related, but we don't know exactly how and how much. What we do know, though, is that certain types of people are more likely to have it. So, for example, atopic individuals. These are people that have other allergy-related conditions like eczema, a food allergy, or hay fever. These are all conditions where the body is hypersensitive, such as on the skin or nasal lining. For asthma, the lungs are the hypersensitive area. Also, things like a family history of either asthma or atopic conditions increases the risk of getting asthma, or being exposed to tobacco smoke in the womb or as a child is also linked, as is being a very small or premature baby. So we know that asthma is more common in certain people, and we also know that asthma flares up and worsens in response to certain triggers, such as infections like a cold or flu. This is really common, and we see it all the time in clinic. Allergies like pollen or animal fur in the case of household pets. Pollution such as smoke and fumes. The environment is really important here, and again, we don't know enough about how this affects our lungs. Medicines, things like ibuprofen, anti-inflammatory painkillers can make the airways narrow and make asthma symptoms worse. If you do have asthma, avoid these types of drugs if possible. The weather, changes in temperature, cold air, wind or heat can trigger it, as well as exercise. Loads of people just have asthma symptoms when they exercise. Another common thing is mold and damp environments. This is really an extension of the environmental issues I mentioned earlier. Poorly ventilated, damp environments aren't great for asthma. Some professions are also more strongly associated with having asthma too. This is because the substances that people are exposed to in certain jobs can irritate or be toxic to the airways when you inhale them. I'm thinking of things like paint sprayers, bakers, nurses, chemical workers, food handlers, welders, or jobs that expose you to things like fumes, flour and grain dust, wood dust, latex, and animals. It's a long list, I know, but you'd be surprised how many people's environment either trigger or even cause the symptoms of their asthma. The classic symptoms of asthma are wheezing, coughing, chest tightness, and feeling short of breath. But other conditions like allergies, chronic obstructive pulmonary disease, sleep apnea, and postnasal drip can also trigger the same types of problems and can sometimes make it difficult to unpick exactly what the causes of your symptoms. If you do have any of these symptoms, it's definitely worth getting checked out for an assessment and a clarification of what the likely cause is. Okay, so we know what asthma is, who usually gets it, and what makes it worse, i.e. the triggers. But how do you diagnose it, especially when it's mild? The three main diagnostic tests are all breathing tests. First is the peak flow test. This is a handheld device that measures how fast you can breathe out. We often do this in clinic and give these machines to patients to measure their breathing at home in the morning and evening over a few weeks to see how things change. Spirometry is a test where you take a deep breath and blow out really fast and hard. It measures how fast you can breathe out and how much air you can hold in your lungs. This is useful for distinguishing between different types of chronic lung problems too. The last one is the pheno test. This is when you take a deep breath in and slowly breathe out over 6 to 10 seconds. This test measures nitric oxide in your breath, which can be a sign of inflammation in your lungs. All of these tests can be done via your primary care clinic, and often only one or two are needed to confirm the diagnosis, along with a detailed history and examination. For kids, the tests are the same and they all require a minimum level of understanding and coordination to perform these tests. This is why most kids are only formally diagnosed with asthma after about the age of 5 years old, as this is when they can actually do the tests properly. In some circumstances, if there is a very strong allergic component, we may also arrange some allergy testings, and sometimes we arrange a chest x-ray too. In some cases, even with the above testing, it can be difficult to say whether someone has asthma or not. In these cases, we'll often refer you to a lung specialist for further tests and investigation. Management is the operative word here. If you have asthma, it will be peculiar and specific to you. How it bothers you, when it bothers you, and what makes it worse are highly personal. Exercise may be a real trigger for you, while for someone else it may be the neighbor's cat. Unfortunately, you can't cure asthma, but the good news is that it can be managed with simple medications, and if you have it as a kid, in many people, it tends to improve and almost disappear as you get older. As I mentioned earlier, we don't know exactly what causes asthma, but clearly there is scope for some lifestyle modifications here to optimize your base lung function. This includes things like controlled exercise, avoiding pollutants and irritants, including smoking and vaping, and avoiding allergens. These aren't always easy to spot, as they could be environmental or even related to inflammatory foods in your diet. Also, be prepared. You won't always be able to predict exposure to a trigger or prevent getting a cold that may flare up your asthma, but you can always have your medications handy and stocked up. Asthma can and does change over time too, so your GP will usually invite you every year for an asthma check to see how your symptoms are. Please do attend these, even if it's over the phone or remotely. It's really important to monitor and optimize your treatment, including following and having an asthma plan. And one of the key things with an asthma plan is what to do if things get worse. I've included an example of this in the description below. In my experience, the people who manage their asthma the best actually understand their own health as well as they understand asthma. It really pays to understand what asthma is too. I always question my patients on their understanding of this disease. If I sense that they realize that the condition is serious and can be unpredictable and some foresight is required, then it's all good. The mainstay of management are inhalers. There are two main types. Relievers. These relieve symptoms quickly, within seconds usually if you have them. This is usually the blue inhaler. Preventers. You take these morning and evening usually to prevent symptoms flaring up and decreasing the inflammation in the lungs. People with really mild asthma can get away with just using a blue inhaler, but most people need to use both. It's a very common occurrence that people either stop taking their preventer inhalers or run out and then feel okay for a bit and don't get any more medication, and then predictably their symptoms get worse quickly and significantly. Knowing your triggers, mitigating them, including taking the annual flu jab, and being consistent with medications is the key to preventing frequent or severe flare-ups. Oh yeah, the other thing that is key is using your inhalers correctly. Most people don't, so they're not receiving the maximum benefit of the therapy. Remember, the point of an inhaler is to get the medication to your tubes in your lungs. You need to suck it down. You don't want the medications to stay at the back of the throat. That's not where the problem is. Check out the short video in the description below to do it properly, and also consider using a spacer if you find it too difficult to coordinate your inhaler technique. For some people with more severe asthma, you may need other medications such as montelukast, theophylline, or steroid tablets, ultimately with the aim of dampening down the overreaction and inflammation in the airways. There's one last thing I want to talk about. When things get worse. Unfortunately, this is a life and death issue, and it's not unusual for people with a severe asthma attack to end up in the hospital. Asthma attacks can be deadly. It can happen suddenly or over a few days, and usually secondary to one of the triggers we've already talked about. Commonly, we see this when people with asthma have an infection in their throat or lungs, which makes their breathing even more difficult. Signs of a severe asthma attack include things like wheezing, coughing, and chest tightness that just becomes more constant and unmanageable, or you're too breathless to eat, speak, or sleep, or you feel drowsy and confused, exhausted, or dizzy, often because you're breathing abnormally and retaining carbon dioxide. If this happens, try to sit upright. Take slow, deep breaths and try to stay calm. Panicking makes it worse. Use your reliever inhaler every 60 seconds and take up to 10 puffs back to back. Call 999 for an ambulance if you feel worse despite your inhaler or you just don't have it. Remember, you can reuse the inhaler again every 5 minutes. Most of the time, an asthma attack will be more moderate than very, very severe, and people will be worse than usual, but they don't often need to go to the hospital. You need to speak to your GP on the same day in this circumstance for additional medications to support your breathing, usually an oral steroid tablet, which is basically a stronger version of the inhaled medication that you take, the preventer, and sometimes an antibiotic is going to be useful. Remember though, never be afraid of calling 999 if you're asthmatic and your breathing is unmanageable. Thanks for watching. Till next time, stay healthy.